Welcome back to another episode of Retire Right. I am Ryan Wyatt, Wyze Wealth Advisor at Wyze Wealth Advisors. And this is going to be a different type of episode for us today. We are actually doing an interview with two Medicare specialists, Rob Martier and Albert Intrieri from Neishloss Fleming and Focused Senior Benefits. Focus of today's episode is really going to be giving an overview of Medicare, the different parts of Medicare, what they cover, what they don't. As we go through the episode, what we're going to do is talk about some solutions for addressing coverage gaps, who you should talk to, and really the why behind you should talk to someone that specializes in this area when you do get to that initial enrollment period for applying for benefits. And lastly, we'll go over some special scenarios or some things that you should be aware of, because if you don't navigate these scenarios properly, unfortunately some penalties can come in based on the types of coverage options you have and when you apply or don't apply for Medicare. So gentlemen, I appreciate you joining today.
It's good to be here.
Yeah, thank you for having us.
I'm glad you're here. If you don't mind, can you just give us, and give the audience an overview of who is Neishloss Fleming, or what is Neishloss Fleming and Focused Senior Benefits, and kind of what do you guys do?
I'll take the Neishloss Fleming part. I'll let Albert take the Focused Senior Benefits
Perfect.
part. Neishloss Fleming is technically referred to as a Medicare FMO, and that stands for Field Marketing Organization. We occupy a space between the carriers, i.e. the insurance companies, and our partner agents and agencies. Basically put, we provide that back-end support to those who contract through us. So Ryan Wyatt, insurance specialist, wants to get contracted with the carriers in your area. We help you out with that. But it doesn't stop there. We have a technology platform that we provide to our agents and agencies, which is probably second to none in the industry. We also provide marketing support as well. So as an insurance advisor, we'll advise a beneficiary. We advise our agents and agencies to give them the best tools available to go out and support their clients.
Understood. And then the Focused Senior Benefits side, Albert, I believe you were going to introduce what you guys do there.
Absolutely. So with Focused Senior Benefits, that's basically the internal agency for individuals who are needing assistance with choosing Medicare options and other insurance options. And basically what's nice about having Focused Senior Benefits a part of Neishloss Fleming is we have all of those resources available, whether that's insight to the market, data from our deaf research team that's part of an integrity partner. A lot of resources to help us further our knowledge of an ever-changing market, so we can be able to help those clients that are coming to us, for services on picking Medicare options.
Perfect. And I think that probably for the people watching this episode, the Focused Senior Benefits side is probably going to be the side that you're a little more interested in, because again, that's the side that applies to Medicare more closely. So let's do this. Let's just, I feel like I always say this on our episodes, but let's start really high level, covering some of the basics, and then we'll get into some of the more unique scenarios, if you will. So
Absolutely.
Can we just talk about, Medicare coverage and the basics? I know there's several different parts of it. I was hoping you guys could maybe highlight what those parts are, what they cover, anything else that you would want to add.
Yeah, absolutely. Do we want to just take it off with?
I'll start with Part A. Simple way to remember it when I got into this business is A stands for admission.
Okay.
So Part A of Medicare will be anything involved inside the hospital walls. And that's about the nuts and bolts of it when you look at the four parts of Medicare. It's an important part because as you reach Medicare age and you reach 65, things start to break down. And you're going to, at some point in time, be in the hospital. And you have to have either coverage if you're still working, which a lot of people do these days. As you know, as a wealth advisor, people are working well into their 60s.
Yeah.
But you have to have some sort of coverage. And if you don't have good group coverage through your employer, Medicare is a great way to go. And it is something that people need to really take a hard look at when they approach 65.
Gotcha. And so you're saying, I believe, and correct me if I'm wrong, that actually there is a case where if somebody is on a group plan, but maybe the coverage is, in their eyes, not very adequate, they could actually make Medicare the primary.
Yes.
Gotcha.
Yeah, Medicare will always pay first.
Understood. Okay. And so then anything else regarding Part A that you would want to cover?
I would say add to Part A is something to keep in mind is when you are working for 40 quarters or more, as you're working in, as a U.S. citizen, that's how most people get Part A at no cost. So something to keep in mind there is typically when you come to Medicare eligibility age, most people will have at no cost for Part A, covering that. Unless you have special unique situation where you don't have 40 quarters working in the U.S. citizen. There is certain requirements to get Part A at no cost, but majority of people will see no premium on that.
Understood.
And quickly, it is important to note that Part A, however, does come with a deductible that changes from year to year. In 2025, it was $1,676.
Okay.
So it's like any other insurance deductible. Once that's met, then you're off the hook for any further expense. But it's important to make note of that.
Now, is that deductible something that like increases over time, kind of indexed with inflation, or is it based on your income?
It jumps from year to year.
It jumps from year.
Understood.
And then as we get further into the conversation here, we'll get to like Part B. Like when you're paying for Part B, that takes into account for income. So that's something we'll go back to.
Okay.
That.
Why don't we jump into that now? So we talked about Part A. Why don't we go over the second part of Medicare, Part B?
Yeah. So with Part B, think Part B is medical. So anytime you're going to your PCP, your specialist, outpatient facility, that's usually covered under Part B. Same thing with if you get, like, let's say you're an individual that needs to get a cortisone shot, or you have cancer, you have cancer and you have to go to regular, scheduled treatments. Typically anything that's administered under your specialist or PCP, that's covered under Part B. So that's something to keep in mind too with your any prescriptions you're taking.
And Part B does require a monthly premium to be paid, correct?
Correct. And the standard is $185, but that does take in income. So if you have a higher income level, you will be, you would see a different higher cost for your Part B.
Sure. And for our clients listening, this is something the premium to Part B specifically is something we talk about in our meetings a lot. The abbreviation for that is IRMA. I'm sure you've heard us talk about it, but as your income goes up, essentially your Medicare premiums can go up, and there's different levels for the Medicare premium, cost and what the associated income is for that premium level.
Yeah, I think this year was 5 different levels, and IRMA, just in case people are wondering, stands for Income Related Monthly Adjustment Amount.
It's much easier to do the abbreviation.
So for your higher income retirees, they will definitely have to take a close look at that and really adjust accordingly.
Right.
Absolutely.
And the other thing too is that those premiums, they are based on income from 2 years.
There's a 2-year lag, correct? Yeah.
So that could, and I know there is a unique role with, we don't need to get into it for purposes of this episode, but there is something unique to keep in mind for if your income was higher when you're working and then you retire, Medicare is going to default to looking at that income from when you were working. There's a higher chance that you're going to have higher premiums because of that, but there is something unique that you can do to essentially even out your income so it's not over-exaggerated, I should say. Now, if there's nothing else you guys want to add for the second part of Medicare, the medical insurance piece, can we jump into the third part, Part C?
Yeah, absolutely.
So, what is it? I know this one's a little bit different than Part A and Part B. So we're talking about Medicare Advantage plans here. So just give us kind of like a high-level overview. Do people need to elect this? Is it automatic? Those kinds of things?
Parts A and B, not generally speaking, that's administered by the government.
Mm-hmm.
Okay.
And then by the states as well. Part C is, as you just suggested, the Medicare Advantage plans. And you have Medicare Advantage plans, and you can also have Medicare Advantage plans with a prescription drug coverage attached onto that as well. That's generally what most beneficiaries will see. They'll see an MA PDP plan. And That will vary from zip code to zip code. You may have one carrier that works in one zip code of an urban area. That carrier might not be further out in another zip code. So again, it's always important to call somebody like Albert at Focus Senior Benefits to discuss what those coverage options will be, which carriers will be in your area, and what their network will be like.
One thing I wanted to add to Medicare Advantage is being that it's through private insurance companies, the reason someone looks at a Medicare Advantage and also a Medicare Supplement, which we'll get into, is because it limits the max out-of-pocket spending an individual could have if they have a bad year. If you stick with just original Medicare, which you can, some people do, they don't want to look further into it, but they have no max out-of-pocket limit spending. So what that means is, if they have a bad year, they could be taking a majority of that risk.
It's almost a higher risk, like it's a higher risk scenario. Of course, nobody can see the future, but if it's protecting yourself against that risk, essentially.
And basically going at it not just alone. You have someone
Sure.
there that's be able to cover, if not all of it, some of the costs. So it's it's a little bit less of a burden on the individual, especially if they're going through something that's drastic, where they don't have their mind focusing on how much money they could be spending out of their pocket.
So correct me if I'm wrong here, but I'm thinking that there's two key takeaways here with the Medicare Advantage plan. So one, it is a way to control risk or take some risk off the table by limiting that maximum out of pocket. Of course, if you have, to your point, Albert, if you have a bad year, you'll be glad that you were on the Medicare Advantage plan because your out of pocket's capped.
Correct.
If you don't, maybe there's a chance because you're getting some additional coverage that you might have spent a little bit more, but again, you're kind of paying that premium for taking some of the risk away. Is that a good way of summarizing point one?
And one thing to add to that too is, a lot of the Medicare Advantage plans are a $0 premium plan. And so as we get into talking about the differences of like the private insurance companies, which I'll hit on more here, I like to make it very simple for the clients that work with me. Think of Medicare Advantage as a cost sharing plan. You're sharing that with the company. Medicare Supplement, cost certainty. You're paying up front so you know what you're paying into. You know what's covered.
Understood.
That's the way to explain that.
That's a really helpful description or way of summarizing it, and I've never really looked at it that way. I know that you also hit on, when you guys were going over the Advantage plan, you hit on Part D, the prescription drug coverage. Is there anything that you would want to add related to the fourth part, Part D?
Part D has undergone massive amounts of change, and we'll go back to the last administration when they had the Inflation Reduction Act. That essentially put a $2,000 cap on prescription drugs.
Okay.
So what that in essence did was, for those who have a lot of prescription needs, it capped that out at $2,000 a year. Some people will meet that, surprisingly enough, in the first quarter of the year. Then they'd pay nothing for the rest of the year. However, those who are a little bit healthier, they're kind of on the hook for that. So in one aspect, it was good. In another aspect, it was not good. And I don't want to get too far into the weeds on this, but by capping it, that cost then was now spread around to everybody else.
Sure. Okay. So I know that we've talked about it a little bit, but just to recap very quickly. So parts A through D, it would be parts A and B that are mandatory to sign up for. Parts C and D, those are the elective parts of Medicare.
Correct. Yeah, and one thing is yes, A and B is automatically, especially if you're taking Social Security, typically it gets automatically.
It's kind of in the application process there.
Yeah, exactly. Okay. And you can stick with just original Medicare. You're not required, especially even if you have credible drug coverage. Like if you're in the military, you get all your prescriptions to the VA. You're not required, and that's considered credible coverage. So you're not going to get that penalty. But for individuals that don't have credible coverage and they don't ever get Part D or they don't get Part C, if they don't act on it in their initial election period, they could either see penalties in the future if they decide to sign up later.
Schedule your complimentary review with Ryan and his team today. Just visit them online at wyzewealthadvisors.com or call 724-271-7019 to get started. That's 724-271-7019. 888-7019 to get started.
We've touched on it a little bit, but I want to expand, is kind of transition into what do people do if they feel that they have coverage gaps. So, I know this opens up the door to the Advantage plan that we talked about. There's also Medigap. So can we just first discuss what isn't covered under Medicare?
Yeah. A lot of Advantage plans, I touched on the $2,000 cap for drugs. Prior to that, a lot of Medicare Advantage plans rolled in things like what we refer to in the business as DVH, dental, vision, hearing.
Okay.
They had some sort of coverage placed in a particular plan. A lot of that has been clawed back to cover the excess costs of covering drugs. So when you're looking at a Medicare plan and you're going to need dental work, you have to get your eyes checked. A lot of people need the hearing aids. Mm-hmm. It's really important to see what coverage is out there for you. And again, it's hard to look into a crystal ball. It's hard to anticipate what I'm going to need at 65 versus what I'm going to need at 75.
Right.
So you kind of have to anticipate those expenses.
Yeah.
And it really will behoove a beneficiary to look into ancillary coverage for dental, vision, and hearing and make sure that you're comfortable with what you have.
It's also, things like cosmetic surgery, I believe, is not covered.
No.
There can be a lot of like chiropractor. If you need any like specialization there, mm-hmm. that's not covered. And then long-term care as well. Mm-hmm. Okay.
And something to keep in mind, like when you're shopping for plans, if you decide to go through a private insurance company once your Medicare eligibility age, looking at the needs analysis, which we will do, like if you ever want to connect with us, we'll break it down what best fits for your needs, because, plans out there do have chiropractic coverage at a certain amount, physical therapy, like especially on the Medicare Advantage plans, they have additional benefits, and that's what stands out for a beneficiary. And then if you go the Medicare supplement route, you just got to look at standalone. So like there is ancillary plans for hospital indemnity, cancer, dental, vision, and hearing. There's a lot of add-ons. If you like that structure, there's a plan that fits what you're looking for.
Okay,
there.
Understood. Now with the Medigap piece specifically, so this is something that would get stacked on top of Medicare, correct?
Yeah.
So can you explain, like, you meet with somebody, they're ready to apply for Medicare, you're having a conversation with them about, what do they want to insure against, how comfortable are they, self-insuring this risk versus not, and you get to the part of saying, okay, we should consider Medigap. Like, where are you shopping for those policies? How do you assess, like, hey, this is what you need versus you don't? Can you just walk us through that?
So with Medigap plans, something also to keep in mind is it works with your original Medicare, like how we were saying the difference between Medicare Advantage and Medicare Supplement. So how to keep that in mind is all covers the same versus letter plans. I would say the standard at this time is usually people, especially aging into 65 now, because for a Plan F, you got to be grandfathered in, which,
Mm-hmm.
we're getting through the weeds here again, but, that's why we're here for. And also with a Medigap plan, Plan G and Plan N is the standard, is what you'll see of most people choosing. And going back to what Rob said about the Part A deductible or premium, there is a deductible phase on Part A. So the Medigap plan, you'll see it covers that. So you're not taking on that. You're really just covering for the Part B deductible.
Understood. And the key there is this is something that is sold by private companies, and again, it works with the original Medicare, not instead of it. So this is really for people that are looking for additional coverage.
Yes, it provides you with more flexibility.
Correct.
A Medicare supplement will probably be looked at more closely by your higher income beneficiaries, your higher income retirees. And the nice thing about a Medicare supplement is that it's portable. Mm-hmm. So if you have those retirees that are traveling, and a lot still do, they get out on the road, so they're going from Pittsburgh and they're snowbirds, or mm-hmm. they've got family in other parts of the country. Anywhere that accepts Medicare, which is most places, most mm-hmm. doctors, most facilities, all you have to do is slap down your card that's been issued to you by the carrier, and you're all set.
That's
the service area.
Yeah, I did not know that. I'm glad you made that point. Is there anything else that you guys that we did not discuss that you feel would be worth going over in terms of addressing the coverage gaps?
Well, I do want to add something to a Medicare supplement too. Is when you're shopping for plans and you're looking at what best fits what I'm looking for out of a plan. A Medigap, if you have, let's say you have cancer or you're going through something of a chronic condition and you have the ability to keep up with premiums, it's a cost certainty plan. So you're paying up front into it. So you're seeing less on the back end when you go get services done. A lot of that's covered for you, whereas you go look on the Medicare Advantage side, it's more of a co-paying structure. So I would say for an individual who is not going to pass underwriting after their 6-month window when they're in their initial election period, because once you're out of that initial election period for Medigap, you do have to go through underwriting and you have the ability to be denied coverage, whereas Medicare Advantage you can't be denied. So something to keep in mind is if you're going to the doctor regularly, you got routine care that you have to seek for a certain condition or cancer. Maybe look at a Medigap plan because it's paying a lot up front, so you're seeing less on the back end, especially if you're going to a routine doctor or specialist.
Perfect. Understood. If you don't mind, I'm going to use that as a segue for to talk about the application process. I think it's. You guys do it every day, so maybe not to you, but I know there's this window and this amount of time before you turn a certain age. It's confusing. So can you
Ryan,
just set
we're
us
in
up?
it every day, and I still Google it.
Yeah.
When's the enrollment period? Wait, what date are we at today? So don't worry about it.
If you could set us straight, we would appreciate that. So when do you apply? Like, when is the time to apply for Medicare?
You have a 7-month window.
Okay.
So you have 3 months prior to your 65th birthday, you have the month of, and then you have 3 months after your 65th birthday to initially enroll into a Medicare plan. One thing that I like to tell people who ask me, and I've been doing this for a few years now, and I'm still not an expert, but when you become Medicare eligible, even if you are still working, it's important to call someone like Albert at Focus Senior Benefits to break down what am I looking at here? Mm-hmm. Do I need to jump into this? Can I defer Part B? I still have coverage. What are the options? It is a complicated landscape. It's hard to navigate, even for people who are in the business.
Right.
And it changes all the time. So it's important to get with an expert so you can break down what your options will be.
Yes, understood. And I agree with you. We always stress being as proactive with, obviously we're doing retirement planning, but we always say, hey, it's better to start earlier or sooner rather than later, because you just get, the more information you get, the easier it becomes to make a decision.
Especially if you, and I just want to add, especially if you don't want to wait till the last minute to apply, because typically, plans start at the beginning of every month. You can't
Right.
start a plan in the middle of the month. So if, as you're trying to get, let's say you apply for your Part B later than you expected, and you're trying to get an 8/1 effective date, and you applied in the middle of the month that we're in right now. Sometimes I know I've experienced this. I've had clients that applied for Part B and they're still waiting to get their Part B enrollment date, effective date. So, it does take time for processing. There's a lot of people turning 65, a lot of people aging into Medicare. So, they're not just going to make you a unique and push you along. They're going through those various applications that are coming through. So planning ahead and having all that, having what your what your options are is always good, even if you don't proceed with it. If you stick with your group coverage, it's just good to know what, be prepared, so you have all that information up front so you can make the best, pick for you, what you're looking for.
And, the other thing too is that penalties can come into play for applying late. So, especially for Part B and Part D. So that's something to just keep in mind, that the timing really does matter.
And then when adding with applying, something to add there too, because you'll see as you age into Medicare and you're in, you're on a Medicare plan. Once you're out of your initial election period, there is time, especially on the Medicare Advantage side, there is times where you can apply for a new plan, because those plans change yearly. So those they go through bids, they adjust the plans year to year. You'll get an annual notice of change letter in September, which your plan will send to you with a breakdown of what's the difference from the year prior to the new year. So that's, once, it's It's called the annual enrollment period, which we're getting leading into October 15th to December 7th. So if you're in a Medicare Advantage plan or a prescription drug plan working with your Medicare supplement, that's the time you past your initial election period that you can make a change if it's not fitting what you're looking for. Let's say you get a new drug added that's not covered on the formulary. You need, routine physical therapy you don't have in your current plan, or maybe it's just the plan doesn't fit what your needs are. That each year you have ability to change within that time frame. And then even, there's other special election periods, that you can use, whether it's weather, that has that ability to change. Let's say you're moving to a different state. That's a special election period. And I don't want to get too in deep with that because that's only unique situations.
Yeah.
But aside from the annual enrollment period, you also have the open enrollment period, which is the Medicare Advantage open enrollment period. And that is from January 1st to March 31st. And what's that for is for individuals that are in Medicare Advantage plan. They go into the Medicare Advantage plan in the new year, but they're unhappy with what they chose, or they didn't review what they wanted to. They say, "Oh, I'm happy with my plan," and then they go take it to the doctor, and something's not right with what they're on right now, and they're unhappy with the coverage. That allows them to do a last minute change before the new year starts. So you have that time frame to make a last minute adjustment if you're on a Medicare Advantage plan. So there is time frames where you can change the plan if needed in certain scenarios.
I appreciate the additional context there. And if it hasn't become apparent yet, for those of you listening, that there's a lot here. And so I also think that the downsides of not working with somebody who lives and breathes the Medicare planning, making sure you have adequate coverage, I think that that's probably apparent. Some of the risks that I would say are inadequate coverage. If you do purchase a Medigap, let's say you purchase a Medigap policy on your own, maybe it's not a high quality policy. I guess you could run that risk. So what other risks would you say that somebody runs by trying to just take this whole application process and getting their Medicare benefits turned on? What risks do they face by doing it on their own?
Well, you touched on it, Ryan. You are on the wealth side. We are on the health side. And I read an article recently, and it's quite frightening, actually. Two of the most important things that people are going to be faced with as they age. Am I going to have enough money? Do I have enough health coverage? Mm-hmm. Unfortunately, a lot of people just set it and forget it. They don't want to be bothered. So I would love to be an advocate, a voice screaming at the top of the mountains, because none of us are getting any younger.
Right.
And you have to be proactive about it. So in terms of the health side and getting into Medicare, again, what I will continue to say this until we're done with this podcast. Call someone like Albert at Focus Senior Benefits. He knows what he's talking about. He will be able to guide you through the jungle and the mess that is Medicare. And basically, Albert would start off with what we call a needs assessment. Hey, where are you at right now health-wise? Let's take a look at it. What do you anticipate your needs will be? What are some genetic conditions? You just, almost like meeting with your doctor.
Right.
You go down that list and you try to anticipate what's going to happen and what your needs will be right now. So it's just important. Like on the wealth side, somebody getting with you guys.
Yeah, and I just think that there's a peace of mind component to it as well, knowing that it was done right and knowing that there was someone, again, that is doing this every single day, kind of overseeing the process, having conversations with you to make sure that you do have adequate coverage when it comes to healthcare expenses, which frankly we see this in retirement plans all the time. Healthcare costs, it comes in waves. Like early on in retirement, you might not have as much, but as people progress throughout retirement, healthcare costs can really be something that significantly adds up. So making sure that you're covered adequately is very important.
Absolutely, especially in an ever-changing market. When you turn 65, you're not thinking about Medicare and healthcare coverage of what expected to you. And when you turn 65, you get bombarded with information, whether it's
Oh, yeah.
multiple emails, in the mail, you get every carrier sending you information. So it's good to have someone that's in that ever-changing market and day to day, understanding what's available to you, because it really comes down to it. It's building your knowledge of what a Medicare covers and doesn't cover, which we'll do going back to what Rob said, doing a Medicare 101, telling you everything that's covered to you from just original Medicare, and then breaking down based on your needs, like he said, the needs analysis, what best fits what you're looking for in a plan. And that's how, the best way to go about it, because there's a lot of, stuff thrown at you, and it's just noise at that point. So having someone that you can sift through that information and find what best fits and what your better understanding of the market as a whole and what Medicare is, that's what you want to look for, someone who can help you out through that.
So what I was hoping to do for the last section of the episode is just cover a few special scenarios here. And what I mean by a special scenario is we can focus on like a married couple, for example, and what are they doing to navigate the transition from working and being covered there to applying for Medicare. Yeah. So the first question I guess I have is, if somebody is, and I know you guys mentioned this earlier, but maybe just reiterate it. If somebody's 65, they're still working, so they're covered on a group plan. Let's say the group plan is adequate. They're not taking Social Security yet, but they're 65. What are they doing in that Medicare, like with their Medicare benefits at that time?
I would say something they have to keep in mind if they're in that eligibility age, but they're still working, is you got to make sure your employer coverage is getting billed first. Like if it's less than 20 employees, or let's say they're kicking you off, then you have to look at Medicare options. If you have the ability to stay on your employer group plan and it's fitting for what you're needing at this time, I would say, yeah, that's fine. Whatever you think is best, especially if you're continuing to working. You just got to make sure with either HR or who's your provider of your employer group plan, or even your employer, you got to make sure that it's 20 more employees, so it's getting billed first. If it's not, then Medicare bills first, and you got to look at other options there, because it may be not benefiting you.
Now, would it make sense for that person, once they reach 65, to still apply for the premium-free parts of Medicare?
I would say yes. For Part A, absolutely.
Yeah. Okay.
Get a head start of it, because it's not going to change your coverage or anything like that. Something to also keep in mind is Medicare is individualized. So if you have, going back to if you have a certain condition or you have cancer, maybe that group plan does not cover what you're needing out of your illness or anything like that, what you need out of a plan. So it's always good to, it's not a group plan once you age into Medicare. So, you got to look best what fits your needs. It's individualized. So that's something to keep in mind.
Got you. And I apologize. I think I used the wrong term. I said the premium free. A, you said most often is premium free. B, obviously has the monthly premium. It would make sense for someone to, even if they're still working, enroll in Part A and Part B, the kind of mandatory parts of Medicare, not the elective ones that you're adding on later. That's correct?
And so you can add Part A. If you're going to continue to work, you can hold off on Part B, because once that triggers your election period for, if you miss your initial election period, that 7th month window, if you continue to work, it goes off your Part B effective date. So that's when you apply for Part B, that's going to trigger it to have your election period for choosing Medicare, so you don't get hit with a penalty, being that you're coming off credible coverage.
Now, if, say, married couple, they're, let's say they're both 66 and only one spouse is working, but it's 20 plus people covered on the group plan. The coverage is they're happy with the coverage. Can the non-working spouse just get take the spousal benefits of the group health coverage and not worry about additional parts of Medicare in that scenario? Or would it be more advisable for them to actually switch off the group plan as a spouse and go more down the Medicare route?
That is going to be a personal choice.
Okay.
If the group plan is adequate or the beneficiary is happy with it, always please apply for Part A at the very least.
Okay.
That Part B, as Albert said, can be deferred. But if you do that and you choose that option, make sure you're anticipating when you will hang it up and retire, because again, it's a pipeline. You go into the system, you go to the Social Security office, you apply for these things. So you have to really be on top of, okay, I'm going to work for another 2 years, but at a year and a quarter in to when you're going to retire, make sure you're looking at getting that Part B because it takes time.
Understood.
And coordinating with your group coverage because
Right.
you don't want overlap in premium. No one wants to pay more than what they're getting. You're paying two different plans, not always the best choice. And then also gaps in your coverage. You don't want to
Yeah.
cancel your plan and then be left with no coverage. And then what if something happens? You're paying the majority of that cost out of pocket rather than having a plan.
People make it work, but just just anticipate.
So the last scenario that I wanted to talk about is, what happens for people that, let's say, they retire a year and a half before they're eligible for Medicare. Now, there's a bunch of different options that are available to those people. If say you leave your employer, say it was a big corporation, so probably had a pretty good group health plan. Option one would be you go on COBRA for 18 months. And COBRA, really what that's allowing you to do is stay on the group health plan, but you're going to not only pay your portion of the costs, but you're also going to pay the employer's portion from when you were working, plus a little surcharge. That's the first option that you have. And again, that's going to kind of bridge you to that Medicare eligibility age. The second option you have is if you're not happy with what COBRA is going to cost you or the coverage that you're getting, you go to the private exchange and you find a policy that you're comfortable with, and you can essentially stay on that until you're 65. Question I have for you guys is, what does that transition from, whether it is COBRA or whether it is on the private exchange, what does that transition to Medicare look like? Is there anything that people need to be aware of?
So yeah, if you're going to be turning 65 and you apply in the middle of the month, so I'm speaking of Medicare, you apply in the middle of the month, so the first of the next month will be your first date on Medicare.
Okay.
Anticipate that, so that way your COBRA or ACA coverage then stops on that last day of the month that you applied for Medicare, and then Medicare picks it up the very next day, and there's no gaps in coverage.
To your knowledge, is there any penalties or anything that people need to be aware of if they don't time it correctly and things overlap?
Well, there's no penalty in terms of overlapping. The only thing there is you could potentially be paying double for what you're paying two different separate plan premiums when you could be essentially paying one
Okay.
if you lined it up correctly. The only penalties you need to be worried about is the Part D late enrollment penalty. So that's make sure you're making the decision in your initial election period, and then Part B late enrollment penalty. Those are the two you need to worry about. So if you apply for your Part B later than expected, and you have you want to make sure you don't, because that sticks on with you for the rest of your life.
Sure.
That's not going away. So just be proactive with it. Make sure you know what's available to you. Get connected with someone that can provide that information so you're ready to go once that hit Medicare eligibility age.
Perfect. Understood. So you can time it so that the gap is essentially non-existent. It almost lines up perfectly.
Mm-hmm.
Correct.
Well, gentlemen, look, I really appreciate you coming on today. One thing that I want to mention for the people that are listening, so Rob and Albert, they're located here in Pittsburgh. So for our clients that are in Pennsylvania and are looking for assistance with applying for Medicare and reviewing any coverage gaps and having a conversation with an expert in that area, we certainly are happy to make the introduction there. The other interesting thing is that Focus Senior Benefits, I believe, they're all over the country. Mm-hmm. And so for our clients that aren't located in Pittsburgh or they're not located in Pennsylvania, as we have conversations with you and you approach Medicare eligibility, what we can do is we can do the same thing. We can talk to Albert and he can actually connect us with someone in your area, and you can have the same exact conversations that our clients in Pittsburgh are having from where you're at. So, gentlemen, anything else you want to add before we wrap it up?
Thanks for having us.
Yeah, thank you for having us.
Absolutely. I'm glad you came in. So,
Yeah.
Thank you.
This episode's content is for informational purposes only. Opinions expressed herein are solely those of Wyze Wealth Advisors, unless otherwise specifically cited. Material presented is believed to be from reliable sources, and no representations are made by our firm as to other parties' informational accuracy or completeness. All information or ideas provided should be discussed in detail with an advisor, accountant, or legal counsel prior to implementation.